Is that a
Ms. Harley?
hand vote, Tam?
Okay, next on the agenda is resolution number 124-2021. We did receive a request from administration this morning to remove that resolution from the agenda. So with your permission, I'll go ahead and move on to the next resolution.
Okay, go ahead, please.
Okay. Next is resolution number 125-2021. This
Thank
is
you all.
approving and publishing the dates of the official holidays for county employees for the year 2022. You will notice that the Juneteenth National Freedom Day observed is listed as a holiday. That holiday is pending approval of Legislative Bill 2021-06, which is farther down on the agenda this morning.
Is that currently a federal bill?
It is.
Okay, thank you. All right. Is anyone here for that?
We have our HR Director, Jackie
Okay.
Curry.
All right, need a motion to approve resolution number 125-2021.
So moved.
Got a motion, do we have a second?
Second.
Got a motion and a second, any discussion? All in favor of resolution number 125-2021, please say aye.
Aye.
Any opposed, say nay. Chair votes aye. Resolution number 125-2021 passed unanimously. Thank you, Ms. Curry.
Next is the submission of nominees to the Wicomico County Commission for Women. The acting county executive has submitted several names for appointment to the commission. The Commission for Women was reestablished by resolution number 106-2021, adopted on September the 21st, to support the mission of the Maryland Commission for Women in promoting social, political, and economic equality for women in Maryland.
Ms. Hurley, will you read the items on the consent agenda for the boards?
Okay, we have resolution number 126-2021. It's confirming the appointment of Catherine L.R. Jones to the Wicomico County Commission for Women. Resolution number 127-2021 is confirming the appointment of Raquel Colston to the Wicomico County Commission for Women. Resolution number 128-2021 is confirming the appointment of Lori Brewster to the Wicomico County Commission for Women. Resolution number 129-2021 is confirming the appointment of Hillary Mullen to the Wicomico County Commission for Women. Resolution number 130-2021 is confirming the appointment of Wendy L. Gordy to the Wicomico County Commission for Women. Resolution 131-2021 is confirming the appointment of Takara Melton to the Wicomico County Commission for Women. Resolution number 132-2021 is confirming the appointment of Catherine Rogers, MPH, to the Wicomico County Commission for Women. Resolution number 133-2021 is confirming the appointment of Bronte Celine DeShield to the Wicomico County Commission for Women. Resolution number 134-2021 is confirming the appointment of Terry L. Whitney, MSW, to the Wicomico County Commission for Women. Resolution number 135-2021 is confirming the appointment of Nicole L. Ackley to the Wicomico County Commission for Women. Resolution number 136-2021 is confirming the appointment of Dominique E. Sessa to the Wicomico County Commission for Women.
Need a motion to approve the consent agenda.
So moved.
Got a motion, do we have a second?
Second.
I have a motion and a second by Mr. Davis. Any discussion? All in favor of the consent agenda, please say aye.
Aye.
Any opposed, say nay. Chair votes aye. The consent agenda passes unanimously. Ms. Hurley.
Okay, next was resolution number 137-2021. This is authorizing the acting county executive to accept a supplemental grant award for shuttered venue operators from the U.S. Small Business Administration in the amount of $806,937.08 to the Wicomico County Department of Recreation, Parks, and Tourism for the Civic Center. And we have Katie Rouse here with the Department of Recreation, Parks, and Tourism, if there are any questions.
All right, need a motion to approve resolution number 137-2021.
So moved.
And a second.
Second.
Any discussion? All in favor of resolution number 137-2021, please say aye.
Aye.
Any opposed, say nay. Chair votes aye. Resolution number 137-2021 passes unanimously. Thank you.
Next is Resolution Number 138-2021, which is the bond resolution. And we have Pam Olin here, Director of Finance, if there are any questions.
Need a motion to approve Resolution Number 138-2021.
So moved.
Second?
Second.
Got a second by Mr. Hastings. Any discussion? All in favor of Resolution Number 138-2021, please say aye.
Aye.
Any opposed, say nay. Chair votes aye. Resolution Number 138-2021 passes unanimously. Mr. Wilbur.
We have Legislative Bill 2021-06.
Can you bring the mic a little bit closer to you? Thank you.
We have Legislative Bill number 2021-06. It's an act to amend the Wicomico County Personnel Manual, Chapter 15, entitled Leave and Holiday Benefits, to include in the listing of official holidays Juneteenth, National Freedom Day.
All right. Need a motion to introduce Legislative Bill number 2021-06.
So moved.
Got a motion. Do we have a second?
Second.
Any discussion? All those in favor of introducing Legislative Bill number 2021-06, please say aye.
Aye.
Any opposed, say nay. Chair votes aye. Introducing Legislative Bill number 2021-06 passed unanimously. Thank you, Mr. Wilbur. At this time, need to adjourn from legislative session and convene as the local Board of Health. Need a motion and a second. All in favor, please say aye.
Aye.
First, need a motion.
Motion.
So moved on the motion.
Do we have a second?
Second.
All in favor, please say aye.
Aye.
All right, then now we're the local Board of Health. Good morning.
Good morning. And I will try not to be lengthy, so you can get you back on track on your schedule. A lot going on in the health department, as you can imagine, but I will not start with COVID, I will end with COVID. So in behavioral health, our overdose information, unfortunately, we're still seeing a trend upward with our overdose deaths and general overdose cases in the county. In 2019, we had 41 overdose deaths. In 2020, we had 47. This year, we are seeing a 25% increase in our overdose deaths, which is very concerning. There are about 5 jurisdictions in the state that are seeing a decline in their overdose deaths, but that is for the first 6 months of the year. The rest of the state is seeing an increase again.
What is the real numbers, Lori? You say 25%. I mean, is it?
So we have data from January to June of 2021, and we've had 16. And in 2020, that was a 25% increase over 2020. So just yesterday, we had what I believe to be 3 overdose cases, which is very concerning. So we're getting out there and trying to reach these people, provide them with the resources needed so that they don't succumb to an overdose death.
Is the health department offering Narcan training for the citizens?
Absolutely. We're offering that. We've been offering that even during COVID. We were doing virtual training, and there's a number of other organizations that are legally able to provide Narcan training as well.
Okay.
The Opioid Operation Command Center, which is out of the governor's office, held a town hall at Salisbury University on October the 20th. And there was a series of recommendations that came out from that town hall. And they're on the OOCC website. They ranged from addressing trauma and adverse childhood experiences, increasing resources for families who are caring for a loved one that has substance use disorder. Many of these individuals that have substance use disorders burn bridges with their family members, and there's no one that they can turn to. A big one that the health department focuses on is addressing stigma throughout the community related to substance use disorders. Believe it or not, it's still a big issue in Wicomico County as it is across the state, because people feel that individuals can control their use. Again, increasing access to naloxone, primarily at local restaurants and businesses. We recently have seen an uptick in overdoses in bathrooms and businesses, so that's been a concern. Expanding peer support, increasing resources on college campuses. Like I said, this town hall was held at SU, and some of the students were concerned about the lack of resources on campus. So they were going to work on that. So those are some of the main target items. The last one is offering medications for opioid use disorder in jails and increasing care coordination, so that when individuals get released from jail, they have an immediate access to treatment, so that they don't relapse.
Well, we keep getting emails from Hudson Health where they have beds available. Do you work with them as far as referrals?
Absolutely. Every day, we asked them to provide us with the number of beds that they have available so that we can move people in if there is a need and they meet that level of care.
Thank you.
In addition, there's going to be additional funding coming out through the opioid settlement that Wicomico County signed on to, but we don't know how much money that's going to be. And of course, the county funds our COAT team, and during the first quarter of this fiscal year, they served 137 individuals with 340 services. So they've been very busy, even though, we held them back from going into people's homes early on during COVID. And my staff said, stop this. We want to get out there and help individuals. So we let them go back in. We are in the midst of our community health needs assessment. We are working with Somerset County Health Department and Untitled Health. They have done a secondary data analysis, focus groups, and key informant interviews, and they're now working on the primary data analysis. We did have better luck this year with our focus groups and had a number of individuals attend, whereas 5 years ago we didn't have as good a response. In our chronic disease activities, diabetes, we have issued many grant awards to a couple of the pharmacies in town to provide access to diabetic supplies for some individuals that can't afford them, because diabetic supplies are costly for individuals, and if they don't have insurance, it's not covered for them. And we're working with a consultant on how to improve our diabetes prevention program enrollment and retention, as we are on a trajectory to become CDC certified in that program, so we can bill for that service. Cancer, we have served over 300 individuals, providing mammograms for 269 individuals, 78 individuals getting Pap screenings, and 25 colonoscopies, and these for individuals that don't have any other access. So COVID activities, our positivity rate today went up. We were hopeful that it was going to continue downward trend, but we are at 7.04 today. The state of Maryland's at 3.38. Our case rate is at 19.17, which is per 100,000, and Maryland is at 14.08. We generally have been well above the state average for quite a while. And if you look at our vaccination rate, we are fourth from the bottom still. We're at 59% of residents 12-plus being fully vaccinated. We continue testing, and we had to increase our testing days to 2 days a week. I think we're able to drop down to 1 day a week here soon because our testing slots are dropping. We are providing vaccination to children 5 to 11 now. Working with the school system and providing vaccines in schools only if the parent is present and consents to the vaccination. I am not going to allow our staff to vaccinate a child even with a signed consent if I don't know that that parent signed the consent. So that's why I'm requiring the parent to be present.
Okay, good.
We also have numerous mobile clinics in conjunction with faith-based organizations and community groups. We have done to date 10,048 boosters, so that's just the health department alone. And 407 doses have been given to the population 5 to 11. We're nowhere near where we should be, but we're taking it down, so.
Miss Brewster, I think it was yesterday I read that a pharmacy inoculated like 100 kids, supposed to be a flu vaccine, and it was COVID. Are there steps to prevent that from happening?
There should be. There definitely is in the health department. I believe that was across the bridge that occurred, and I can't speak to how it occurred, but I know that that was reported to the state, and the state's working with that pharmacy on how to avoid that from happening.
Okay, thank you.
I did want to mention that I forwarded to Ms. Hurley our annual report for fiscal year 21. It hit the press today, so you all should get a copy of that. In 2 days, it is National Rural Health Day. So we will be celebrating that with the state. And the last thing I want to bring up is that we are doing a memorandum of understanding with the library. The state is providing us with at-home COVID test kits for distribution to the public, and the library has agreed to be the group that will provide those. You don't have to give a name. You just, for a family, you're limited to 4 kits at one time. But I think this will be an opportunity for individuals to receive at-home test kits that can't otherwise afford them because they are pricey.
And are they being accepted? Are they widely being accepted as valid? The at-home test kits.
Yes, they are.
Okay.
I mean, the state purchased these, and they're providing them to us free of charge.
Okay.
And we are being told that we will get a monthly allotment, but our test kits arrived today. I don't know how many we're getting today, but not every jurisdiction agreed to accept their test kits, so maybe I will get a few more than what I anticipated. So.
All right.
Ms. Brewster, do you have the, are the wellness clinics at the schools, are they opened?
Our target is the 1st of December for one of them. We had a staffing issue. COVID led to some staffing changes as well as resignations. And we lost one of our nurse practitioners that did the wellness center services. She died a couple of weeks ago. So we have a loss there, but our goal is to start that up the 1st of December.
Okay. Mr. Cannon?
Yeah, thanks for being here.
Certainly.
On the COVID numbers, what would you say as far as how many people, I don't remember now whether you do it monthly, whether you do it weekly, but what would you say the numbers are as far as, let's say, in the last month, the last week, as to how many cases, new cases?
I get a daily report on that. If you let me look at my phone,
Sure.
I can tell you how many we had today.
It's online, isn't it?
It is.
Yeah, sorry about that.
That's okay.
And then my other question would be any particular demographic age group, whether or not they're vaccinated or unvaccinated?
The majority of them are unvaccinated,
Okay.
but we are seeing breakthrough cases for those that are fully vaccinated, becoming COVID positive with the Delta variant. So, we had 20 new cases today.
Today.
And I will say there for a while, we were receiving about 300 positive cases a week. And keep in mind, we have to contact each and every one of them to find out who they've been around. Very draining on our staff. So if you run into a health department staff member, please be very nice to them because they're working very hard. The other thing that I would like to mention is we've had over 26,000 calls to our COVID hotline since we opened it up. And it's still going very strong. We have about 100 calls a day to our COVID hotline.
What are the questions?
They range from where can I get vaccinated to here's what's going on and what can you tell me as to what I need to do.
Okay.
And we get a lot of calls after hours, of course. People get home and they think of something and then they'll call us. So.
Yeah.
What is your,
Mr.
Quick question.
Okay.
We're just sort of stuck in this. Seems like with COVID, we're in the same place just week after week, even though this has gone on for so long, and our vaccination rates are just so low compared to the state and the country. I mean, is any kind of a campaign, going on from education, encouragement, or whatever to just improve our numbers? Because it's so disruptive to, the community, from everything from, workers are out, and then productivity is affected, and things can't get done. In the schools, daycare, someone gets COVID, and the daycare has to close. Now parents have to stay home because they have no daycare provide. It just goes on and on.
So we've done a lot of education, and we have a lot on our social media outlets. We do a lot of work with that on Facebook, Instagram, Twitter. But we also, during the summer months, did a door-to-door campaign that was very labor-intensive, but we had door hangers where we went to every residence in a neighborhood where we were providing vaccine, trying to get them to be vaccinated. I beat feet in Del Mar one night trying to enlist people to get vaccinated, and that night we had 7 people, and we contacted several hundred. I don't know what the answer is. If you look at the jurisdictions that are the lowest in the vaccination rates, it's the rural counties, with Somerset and Garrett being at the bottom, and then Allegheny, and then Wicomico.
Well, Ms. Ackley had a question.
oh, okay. I was just, because I'm on your committee, so I looked through all the data specifically. And one of the things I found was very interesting is that Willards has the highest level of food insecurities in the county. It was interesting to see, and I don't know if I've shared it with the other council members.
The highest level of what?
Food insecurities in the county. But it was, if you have that full report that you could send us, it is extremely informative of what our county really looks like. Women, I believe was the disparity with income. It was 28,000 compared to 40,000 with men, the difference there. So it's a very interesting, and I think everyone would really benefit from reading through it.
Sure.
All right, Mr. Holloway.
What is the number one reason you hear excuse if someone doesn't want to get vaccinated?
Honestly, it is that they think that there's a tracking device in the vaccine.
Heard that.
That's it.
Are you telling me there's not a tracking device in there?
That's correct.
How do you know?
I can't, well, this
just
is,
forget it.
this is the biggest tracking device that we have.
But anyway, and that's correct. I mean, that's the number one reason you hear. They're not afraid of ramifications from it, making them sick later. That's not one of the reasons. It's because they think there's a tracking device in it.
And it's so surprising, just some differences I've seen. I was just traveling some in the last month or two, but, you know, I've been a few places where, I mean, their vaccination rates are 80, 85%. However, you go places, everyone's wearing a mask, even though, I mean, they're so conscious of it. And then I've been to other places where it's like us with 50% and so forth, and no one's wearing masks. It's just such a vast difference as you move across the country.
Absolutely. And, you know, if you look at the highest vaccinated county in the state, it's Montgomery County. And when you go to Montgomery County,
Everybody's wearing
everybody
masks.
has a mask.
Yeah,
But they also had the highest numbers of COVID too, right?
not as a percent.
Not now, no.
Do you know why the manufacturers were allowed to be excused from liability?
I can't answer that.
Because that was one of the questions that I've heard numerous times as well.
One of the other reasons why people are concerned about the vaccine is the side effects from the vaccine.
Myocarditis.
Well, but also the just feeling crappy.
Yeah.
And people feel like that during flu vaccine as
That's right.
well. But that's one of the other reasons we're hearing.
I hear from younger people, they have a concern about if they haven't had children yet, they don't know what the effects of. I've heard that.
Yeah.
Mr. Hastings.
I was going to say, I did have, by the way, this past week, a good friend of mine. He was vaccinated. His wife was not, and they got COVID. The family holded the kids too, and here in Wicomico, and the wife was surprised to realize this was a month and a half ago or more that they got COVID, and she's still recovering, and they're all in their 30s the kids aren't obviously, but so it's folks of all ages and different groups, but it really does make a difference. It seems to be if someone's vaccinated that their recovery time, and that was news to her.
Yeah, and if you look at the hospital data, it's ages all across the board, individuals that are ending up in the hospital. But what we are seeing is the deaths related to COVID are generally of the unvaccinated population, and that's still concerning as well. I will say that I get a line listing each day of any COVID variants that we're seeing in the community. And today we had a report of 4 individuals with the Delta variant, and one of them was the age group 0 to 9, which is very concerning because these children that are not vaccinated, some of them can't be, they become very sick and have to be hospitalized.
How do they know it's the Delta variant?
They do, they send it to the specimen to the state lab for review of which variant is in the
So they
specimen.
can tell.
Absolutely.
Okay. Mr. Cannon, were you going to say something?
Well, I was just going to double back on the opioid. You went really kind of fast, and you said there's an increase. Is that increase mainly due to the fact that you think that there are more addicts in this area, that number is increasing, or is it simply the fact that there's more fentanyl and it's becoming more dangerous to experiment with the drugs?
I think it's a number of issues, but the fact that fentanyl is out there and that's the primary drug that's killing people, that's definitely one. But as we've seen all across the country during COVID, an isolation issue and people not being able to be around other people and becoming depressed, and then they seek out drugs to try to treat their mental health issues. So we've seen that as well.
Ms. Ackley, were you going to say something?
Yep. Sorry to jump back to COVID again, but what is the protocol if a child is exposed to someone who tests positive in whether it's in school or out of school? They need to be removed from school for 2 weeks until they have received a test.
Well, the state is allowing each school district to make a decision as to which tier they wish to utilize. And I don't know that Wicomico has voted on theirs yet, but there's the ability to test to stay, so that if they are a contact of a positive, then they could test, week 3 or day 3, 5, 7, and as long as they were negative, they could stay in school. There's option 3, which most school districts are going towards, and that is correct and consistent mask wearing, as well as other mitigation techniques being applied in the schools, that as long as those things occur, they will allow them to stay in school even though they're a contact. That can become very confusing to parents, because while they would be allowed to go to school, they couldn't go anywhere else. When they're out of school, then they would have to be quarantined. Little bit different models, but the school system has to make that decision moving forward. And I don't know that they voted on that at the board meeting. I haven't heard.
So the current policy that they have, it's not something you had recommended or the health department had recommended, it's something that they...
The current policy that I agreed upon was that the students would be quarantined if they were contacts, and that was the recommendation of the state.
Okay.
But Maryland Department of Health has made changes to their recommendations and allowed them to choose these 3 tiers. I'm okay with a tier 3, which is if there is consistent and correct mask usage, that they could stay in school. But I did warn the school system that that could be very confusing to the parents, particularly related to quarantining at home. So
It's causing quite a bit of confusion, yeah.
Yes.
Mr. Hastings?
I don't want to jump around, but just one other question was Mission of Mercy. I think that's one of the best things that our county has done, and I know that's not happened during COVID, but do you know any more about what we're doing for the mass dental clinic?
I haven't heard if they are planning another Mission of Mercy. Dental services are probably one of the greatest potential exposures for COVID. And that's why our dental clinic had to put some strict measures in place for all of our services. But sorry, I can't answer that. I haven't heard.
All right. Any more questions or comments?
I have one question.
Mr. Holloway?
Anyone incarcerated, are they required to get a COVID shot?
Yep. And I will say that we've had outbreaks at the detention center. We have had to assist the detention center with testing of all their staff and the inmates, but nobody can be required to receive a vaccine. We still are not certain how the federal vaccine mandate's going to play out, because there is the federal stay on that.
From a judge?
Yes. So we'll see what happens with that.
Okay. Any more questions or comments? Ms. Brewster, thank you very much.
All right, thank you.
Right, this time need a motion to adjourn from a local board of health and reconvene into the legislative session. Need a motion.
So moved.
Do I have a second?
Second.
All in favor, please say aye.
Aye.
Any opposed, say nay. All right, at this time, we're going to open the floor to public comments. If there are any public comments, please limit them to 3 minutes or less. If you have any presented material, you may submit to council members. Please include 10 copies, no derogatory comments. Do we have any public comments? Any public comments? All right, moving on to council comments. Do we have any council comments? Mr. Hastings? No? Okay. Comments from the president. An email that I sent to the State Board of Public Works is the subject of a public comment and a recent media report that include the incorrect charge that I asked the board to scuttle, quote, scuttle, a grant of $700,000 to convert the existing ball field of Harmon Field to a complex of pickleball. The public is entitled to know why this charge is completely false and what I actually requested in my email to the board. My message to the Board of Public Works states, quote, I'm requesting that the board postpone discussion and action on this matter. To postpone is what I requested. Thus, the notion that I have asked the board to scuttle is completely false. The public should know why I asked the board to postpone the discussion and the action on the grant. This important aspect is not reported in the media, so here are the actual facts. The County Council learned of the desire of the executive branch to convert the ball field at Harmon Field to pickleball courts about 6 months ago, when the acting county executive asked the council to discuss a public-private partnership opportunity with the YMCA proposed by Mr. Steve Miller, the Director of Recreation Parks Tourism. In Mr. Miller's memo of April 26, 2021, states that he was requesting council's initial support of the concept and a memorandum of understanding with the YMCA. Thus, on May 18, 2021, Mr. Miller and several YMCA officials discussed the proposed pickleball complex at a council work session. At that time, there was no mention of anticipated cost or source of funds. At the end of that work session, we asked Mr. Miller to prepare a proposed memorandum of understanding with the YMCA and bring it back to the council, and also indicated that a few questions that needed to be addressed based upon the discussion of the work session. For some months following the work session, the council received no further information from the executive branch, and a proposed memorandum with the YMCA was not provided for consideration by the council. Therefore, I was very surprised to learn in mid-September that the Board of Public Works had scheduled for consideration a grant of $700,000 to convert the existing softball field into 12 pickleball courts complex and other work at the Harmon Field. The executive branch requested that grant without getting back to the council as requested in May, and without even notifying the council about the grant request, either before or after making the request. Accordingly, on September 14th, the very day before the board's meeting, I sent my email to inform the board that the proposed pickleball complex and the request for funding had not been approved by the council, and that several council members have some serious concerns about destroying a perfectly good softball/baseball complex. To reiterate, my message requests that the board postpone discussion and action on this matter, so the charge that I asked the board to scuttle the grant is incorrect. Obviously, the situation could have been avoided if the executive branch had returned, as requested at the work session in May, to further discuss whether to destroy the ball field to create a pickleball complex before requesting the state grant for funding to do so. And if Mr. Psota had bothered to advise that he and Mr. Miller wanted to request the state funding, that would have been discussed promptly by the council. Instead, the council was kept in the dark, possibly deliberately so, about the grant request for something that the council had not approved and the executive branch had failed to discuss with the council as requested several months earlier. And that's my statement. Thank you very much. At this time, need a motion to adjourn from legislative session to go into open work sessions, followed by a closed work session pursuant to Local Government Article Section 3-305B8 to get an update on pending opioid litigation to protect the attorney-client privilege. Need a motion.
So moved.
Do we have a second?
Second.
Have a motion and a second. All right. This time we're going to move into open work session. I have the proposed amendment to the fiscal year 2022-2026 capital improvement program in fiscal year 2022 capital budget for Piedmont obstruction removal project. Mr. Tony Rudy, excuse me. Welcome again.
Good morning again.
For the record, can you introduce yourself?
Tony Rudy, Airport Manager. So as this project went on, we budgeted, the original budget amount was $250,000. This was to basically bury utility lines along Airport Road and also remove some trees that were considered obstructions. The initial budgeted amount would have covered the program if there were only 2 poles to be removed, and if we knew all of the additional costs that were added on later. As we got looking into this, and as DPL started looking at designing this project, we realized that just to remove the 2 poles. On the third pole that would have been staying in place, the engineers indicated that the third pole would have to be raised approximately 8 feet to meet their design criteria and support the equipment that's on the pole. So with that raise, that actually put that third pole up into the critical area that we were trying to mitigate. So we had to actually go from removing 2 poles to removing 4 poles now. So obviously that extended the area. Further, what we found out later is after we got with DP&L, they indicated that the cost of trenching and installing conduit along that whole stretch would be funded by the customer, us. So that was an added expense we did not anticipate. Furthermore, there are 2 other utilities on those poles, Comcast and Verizon, and we found out later that those costs would have to be covered as well to bury those lines in the ground. So all of that adding up greatly increased the cost of this product from what we originally anticipated. So therefore, we're asking that unused funds for fiscal year '21 be transferred so we can cover these expenses and take care of this project.
Great. Any questions or comments?
And the expenses are those outlined, what we have in our brief book here, is that the 60,000, the 164, and the 40?
Yeah, so adding those to our current budget will cover the cost of this additional work.
Yeah, I'm fine with that. I know this has been an issue for a while, trying to get these poles. That's been a big hang-up. We need to get those poles
Yeah.
removed so we can resolve that. And if it's, you don't have much choice. If it's 4 poles, it's 4 poles.
Two of those 3 projects we're asking transfer funds for. We actually used CARES money to cover those projects, so that's where that got freed up from.
So it's 260-some thousand?
The total would be, it's the 250,000, which is the original budget amount, and then adding an additional $264,563.
So that's on top of it?
Yes.
And what is the statement that it was absorbed by CARES?
Well, the two projects that we're actually covering under CARES that were taken out of the FY21 budget were the site preparation for our maintenance facility and our parking lot rehabilitation.
So what I'm reading is the 264,000 was already absorbed by CARES. Is that what that, Ms. Olin?
Pam Olin, Finance Director. So in last year's 21 budget, these items were funded by PAYGO. And those projects haven't been started. There's been no encumbrances against them. 2 of the 3 projects, CARES money has now paid for. And so we have these funds sitting in the capital project fund. It's already moved out of the general fund. It's in the capital project fund. And we're asking for the money to move from one capital project within the capital project fund to this other one to be able to accomplish this obstruction removal.
So, I mean, end of the day, we were spending this money on capital projects, and then
Correct.
we
So
got some CARES money we didn't have to, and now it's sitting there, and now we can use it for this.
Correct. And so there's no additional money being requested from the general fund. It's money that was already budgeted in '21, already moved from '21's results, put into the capital project, funding these 3 projects. So the resolution that you would see would actually move it from specific account numbers that we had set up into the obstruction removal account number.
Right, and that's what I wanted to clarify, and I agree with Mr. McCain that it has to be done.
So that's kind of the financial mechanics of it, but it's no new money from the general fund. It's money that had been previously allocated and we're asking to repurpose.
Okay, and so we have to have a hearing on this and with a resolution.
Right.
Okay, any more questions or comments? Okay.
Because
Ms. Hurley?
there's 3 weeks, it can go on the 7th?
Yes.
Okay.
December 7th at 6 p.m.
Thank you.
All right, anything else? Thank you all very much.
Thank you.
All right, at this time, we can convene for lunch and reconvene at 12:30.